A recent study revealed that our community's health and everyday challenges, known as social determinants of health, affect our overall health more than we realized. And joining us today to talk about this is Natalie Degbor, Assistant Vice President of Analytics at UnitedHealthcare. And Natalie, thanks for joining us. So what are social determinants to health?
Sure. Social determinants of health are the non-medical factors that influence health outcomes. And surprisingly, 80% of our health outcomes are determined by these external factors, and only 20% is influenced by the medical care we get. So these are things like where we live, our access to healthy foods, and even our social life.
Well, this particular study is being called a game changer. Why is that?
So until now, we've not been able to tie together medical claims and individuals' social determinants of health. So together with Health Action Council, we were able to marry this data and look at the claims of over 200,000 members to find out where their issues were and really help employers, meet their population where they are and find out where their needs are, so that they can boost the health and productivity of their workforce.
What really stood out in the findings of this study?
So I think one of the most shocking things was that more than half of the adults we looked at were facing one of these challenges. So they were facing either financial, food, or housing insecurity, or they were socially isolated. And when adults have these issues, they have a higher rate of depression, anxiety, and suicidal ideation. Looking at the kids, we found that 4 out of every 10 kids is living in a house where their parents are facing these issues. And we found that the kids are also facing higher rates of anxiety, depression, and suicidal ideation. And of course, overall, people who are facing these social determinants of health have a higher cost, especially those that are living in states with poor health.
And speaking of costs, I've heard that poor healthcare decisions can drive up expenses too, right?
Yeah, I think that's a good question. We look at healthcare data, and when we're looking at all of this massive amount of data, it's really easy to say, well, these are bad decisions, these are good decisions. But we need to put ourselves in the shoes of the members. And if you are facing some of these factors, sometimes you're limited in the decisions you can make. You're a parent, you need your paycheck, you can't skip work, but your kid is sick. So you take them to the ER so they can get their meds, and you can go to work and they can get to school or daycare. That was the only choice that person had. It may not be the best decision, but that's what they had to do.
So when it comes to the insights from the study, what can employers do with that information?
That's a great question. Employers can actually do a lot. They can look at their data, understand the population, and understand that it's not a one size fits all solution. There are going to be different portions of your population that are affected by maybe food insecurity, and others that are facing housing insecurities. So just really understanding their data and creating programs and plans to help address those needs. And of course, always promoting a relationship with your doctors so that we can prevent future health problems.
This is a lot of great information. Natalie, where can people go to learn more about this study?
They can go to the website healthactioncouncil.org.